Welcome back to Your Mouth Matters, the podcast where we dive into how your oral health connects to your overall health. I am Dr. Rebecca Taylor, and today I'm thrilled to be joined by Ceylon, an integrative nutritionist with a master's in science from Bastyr University. Ceylon has been a health coach for over 5 years, specializing in gut health, weight loss, identifying food sensitivities, and helping people reduce bloating and improve their gut function. She runs her own virtual practice, Body by Ceylon, and also works with Microbiome Lab, a leader in developing science-backed probiotics and gut health solutions. Today, we're talking all about the gut and oral microbiome, the role they play in your overall health, and how innovative tools and products can help restore balance from the inside out. Let's jump in. Well, thank you so much, Ceylon, for coming on and being on our podcast. It's really an honor to have you.
Yeah, thanks for having me.
So I just kind of wanted to give our listeners kind of like your background and like, talk a little bit more about who you are and because you've got lots of really great info to share.
Yeah. So my name is Ceylon, and I am an integrative nutritionist. So I work with patients in gut health mostly. And of course, with that comes things like bloating and indigestion and acid reflux and food sensitivities. And a lot of the times clients come to me for wanting to lose weight, and so it kind of all ties together. But gut-led weight loss is what I call it. So I have a telehealth practice called Body by Ceylon. And at the same time, I also partner with Microbiome Labs. So I am a account manager here in Washington State for Microbiome Labs. So
awesome. So I feel like, gut health and like oral health, where I feel like in my practice, I'm just talking so much about gut health and how it's so linked. It's all one tube, right? We've got the mouth. Actually, I kind of feel like it actually starts in the nose. This is like you've got the nasal microbiome, you've got then the mouth microbiome, and then you've got, the whole gut microbiome. So it's kind of all this like one tube, and each area has, different pHs and different functions, but the microbiome and the bacteria that live in these certain areas, they really should be working for us. And it feels like with all of the medical interventions, with whether it's a C-section birth or it's from antibiotic use, maybe when you were a kid or you had an infection, if there's not like, or even diet, right? If you're not eating fermented foods, there's like the microbiome ends up getting kind of funky, right? And it starts to not actually work for us. And I feel like a lot of the times, we end up going through life and having all these health issues, and we don't even realize that it could actually be stemming from the gut. So I would love, I'm not an expert in gut health, but I'd love, since you have the background, can you talk to us a little bit about like, why is the gut microbiome so important?
Yeah. So I like to, I think one thing that we maybe not only forget, as practitioners forget this, but just we're not really taught is that everything sort of starts in the gut. I know we hear that a lot, but when I started learning like, gut health and these bugs that live in our intestines are not just about digestion. Like, they can help with bloating and acid reflux and gas and all of that, but also our immune system. I think 70% or over 70% of our immune system is in our gut. That's like wild. And another like amazing area of research that I'm really excited about is the vaginal microbiome. These microbes that, yes, start in the gut can actually translocate to the vaginal microbiome and can affect fertility, like recurrent pregnancy loss, and
Wow.
these large issues that a lot of women are struggling with now, right? The skin gut microbiome axis, that's another one, is if we see rashes or acne or premature aging, a lot of that is a reflection of the gut, and meaning the gut microbiome. So it's sort of this like control house, I like to think of it, for the rest of our health, not just our gut. So, and of course, like in your work, the oral microbiome, there's a big connection there. So we see that just by addressing what we call dysbiosis, so when there's too much bad bacteria, not enough good, to put it really, really simply, we actually see the other areas of our body, not just our gut, reflecting in that way as well. So improving of the oral microbiome by improving our intestines. So it's just incredible.
Yeah, it's amazing to me how, as you start to learn more about the diseases that we have in dentistry, right, whether it's periodontal disease or cavities, those are kind of the two main ones. But how much of that is impacted by the gut microbiome? It's just as you start to learn and you go down that rabbit hole, as a dentist, you're like, oh my gosh, like this has nothing to do with what I'm doing in the mouth. This is all systemic body stuff, and it's all stemming from the gut, right? So typically when patients come in, and if we see we do microscope slides and we look at your plaque and we look at what kind of bacteria are in here. And sometimes we might even do salivary diagnostics where we have patients, swish with a saline solution, spit it in a tube, and then we send it to a lab and we figure out what is the oral microbiome doing. And the interesting thing to me is that, if you have a lot of dysbiosis and bad bacteria in your mouth, we are worried about that getting systemically, right? We're worried about when you floss your teeth, if you get bleeding at all, that can get into the brain, that can cause issues with dementia, Alzheimer's. There's also heart risk. But it's also interesting because, we're swallowing all of that bacteria too, right? And same with the nasal microbiome, right? If you have postnasal drip, if you have a lot of this dysbiosis in the mouth, you're swallowing all of that into the gut too. So it feels like, what came first, the chicken or the egg, right? A lot of times in the dental world, we're like, well, we got to clean up this microbiome, but how much of this is actually stemming from down here, right? Is this an ascending or a descending type of issue, right? And so it's fascinating to me how just by changing the oral or the microbiome in the gut, that we actually, and you guys have done studies with this with Megaspore, I think, and the products that you use, but just by changing the gut microbiome, you're able to change the oral microbiome without rinses, without oral probiotics, right? And the same is true for the microbiome, the vaginal microbiome, or the nasal microbiome even, right? So it's just so fascinating. And I think we always think of the areas of the bodies as so compartmentalized. And but if you really zoom out, I mean, it is all one tube, right? And so it's just, I feel like it's just such an area where most people need support.
Yeah. And I think it really hit me when I learned about what we call enteric circulation. So it's sort of this idea that there's metabolites or byproducts that come from these bacteria in the gut that can go into circulation. And what I mean by that is into the bloodstream and actually come out through into the oral cavity, into the mouth. And it goes both ways. So I think to one of the examples that you were giving, but if we've got, let's say, an overgrowth of pathogens in the mouth, and let's say someone's under high stress or they're not eating very well and their stomach acid slows down, so it's less acidic, there's less bile production, and we're swallowing these pathogens, a lot of those pathogens can actually get through now through the stomach, which is supposed to be so acidic that it will, break down a lot of those pathogens and protect. But now we're getting those bacteria into the gut and they're not supposed to be there. And so the gut is having to deal with that and then creates a lot of inflammation. And that inflammation can wear away at what we call the mucin layer. So the lining of our the hose, so to speak, that's what I like to say, and leak into the blood and go actually back through the portal vein in the liver and back into the gut, but actually through systemic circulation. So those toxins can go back into the mouth and cause more inflammation and redness and all that and periodontal disease. And like you said, in the brain too. So there's a lot of mechanisms by which that, there's connections, not just that, but that's just one example of how helping and addressing your oral microbiome can address your gut. And it goes the other way too, right? You can imagine if there's gut dysbiosis, and that's where a lot of this does start, is that these, what we call, I'll just bad bacteria, but pathogenic or opportunistic microbes that overgrow and infect, they can release this toxin called lipopolysaccharide. And it's one of the most toxic things to the human digestive system. And it's not supposed to get into the blood. It's supposed to be excreted, through the stool. And lipopolysaccharide or LPS will, just like I said, wear away at that mucin layer and break through. And this is what's out on the internet as leaky gut, right? We talk a lot about leaky gut, but the scientific term for that is metabolic endotoxemia. So you can go online and look up study after study on metabolic endotoxemia, which basically just means toxins in the bloodstream and where it's not supposed to be. And that's where we get this. I mean, it can go to our skin, yes, like to the vaginal microbiome, the liver, to the brain, right? So whether it starts in the speaking of this, right, the oral microbiome and the gut connection, whether it starts in one or the other, they're deeply connected.
Yeah, I think we like in dentistry, we talk about like leaky gut, but also leaky gums,
Yes.
because it's kind of the same concept, right? It's like these junctions are allowing this bacteria to get into the bloodstream, and then that triggers our own body to kind of, go on alert, right? And we're not supposed to have that type of bacteria in the blood. So I think that a lot of our patients, when they come into the holistic office, they are kind of surprised that we talk about the gut so much, and one of the things that we in our practice, we use your guys' products, Microbiome Labs products. I actually discovered your products when I had a mold exposure, and I was literally had black coming out of my nose. Like, it was really bad. I got very, very sick, a lot of brain fog and a lot of post-nasal drip. And I just knew that my microbiome was probably not doing well.
Yeah.
And so I learned about those products. I also, my daughter, during that same time when we had the mold exposure, when I had the mold exposure, I actually got like this crazy rash over my body. Like, it looked like ringworm or like eczema, like literally head to toe. Could not figure out what was going on. It took months for it to go away. I started taking the probiotics, it went away. But my daughter, who's 2, she didn't have any of the like nasal stuff symptoms that I had, but she did start to get eczema. And, this kid from day 10 years old got a microbiome test. I was like so on it. I was pregnant. I was doing gut tests when I was pregnant. I was, making sure I was taking all the right probiotics. I was doing everything that I could, right, to make sure that my baby came out with like a good microbiome, because I know that microbiome comes from mom. It also comes from, dad and other things in your environment too, but a lot of it comes initially from mom, and then it sets over time, right? The microbiome in a child is going to change. So if you're breastfed, baby, that's going to be more bifid, and then over time as you introduce foods, it's going to change and morph that microbiome, right? So I was so aware of this having my daughter, and did all these gut tests, and her microbiome was just so great. Like, all the tests came back. She was like passing with flying colors. The doctors were like, "Why are you doing this?" And I'm like, "Because I'm obsessed with data." Yeah. And so we just kept going. And then when we had this mold exposure, I didn't even realize what it was. I just thought, I have like a really bad cold or whatever. But I started to know some eczema on her, and I'm like, that's weird. I know that that's probably a gut thing going on. So I did a gut test on her, and it came back that she had some bad stuff in there. And I'm like, okay, like, this is fine. Like, I'll fix it. But I'm like, this is really weird. And so anyways, eventually I figured out, this is mold. I had the rash myself. But the most amazing thing is that I was working with a practitioner with my daughter who had recommended certain types of probiotics. And so I was giving her those probiotics, and then we were retesting her microbiome and, not seeing a lot of change in her microbiome or her eczema that she had. And, everyone's like, well, maybe it's not the gut, maybe it's the pool, maybe it's chlorine, like all these things that we put into our head when we can't figure out what's going on, right? And it was amazing because when I put the connection together that, this is probably from mold, and she should probably be on the probiotics that I'm on, to help reset the microbiome and be taking a spore-based probiotic. And your guys' protocol is to be on this protocol for like 3 months. But in about a week and a half of her being on the same protocol with these supplements, her eczema was like 90% better. And I was just like, whoa. Like, I actually my nanny sent me a picture and said, Quinn's eczema is it's really bad today. She sent me a picture of her in the bathtub. And I was like, oh my gosh, it was like her whole back. And so then a week and a half later on these supplements, we're in the bath, and I'm like, oh my gosh, I don't see any of that. So I took a picture. Like, I'm trying to make same lighting, same everything. But it was really amazing to see that the probiotics, the spore-based probiotics, and the protocol that you guys have set up at Microbiome Labs, like, I've seen it work in action very quickly when
Yeah.
a lot of other probiotics that I have been told to take, or, you see, oh, these are the best probiotics, even your doctors are telling you to take them, they don't quite do it. So can you tell us about like the spore-based probiotics and the different kind of protocols that you guys have figured out at Microbiome Lab? Because I feel like, a lot of people are like, oh, well, I'm on a probiotic, or, oh yeah, I do that. And you're like,
Yeah.
okay, but like it matters, the brand, how often, the protocol, right? I love your three-pronged approach. So can you talk a little bit about that?
Yeah. Yeah. And first of all, that's an incredible story, to see change like that. But I will say we hear that story with our products quite often. It's so wild. It's one of the reasons why I work for this company. I'm not just saying that, I used the products for years before working for Microbiome Labs. That's kind of how I got the job too.
Nice.
So yeah, so Microbiome Labs, we specialize in something called spore-based probiotics, like you were just talking about, which are very, very different than what you're normally going to see on the shelf. So a traditional probiotic, as I like to call them, usually contains some sort of lactobacillus and bifidobacterium blend. And these are two families of bacteria that are needed in a healthy gut. However, they are very, very vulnerable. And so you have to refrigerate them. And you'll see this because whether you're going to Costco or even your local practitioner or the food co-op or Whole Foods or wherever, most of the time these probiotics are refrigerated. And the reason for that, like I said, they're so vulnerable, but there's kind of an issue there with stabilization and being able to colonize in the gut because the joke, our founder, he always says, like, if they can't survive at room temperature, like 70 degrees, and you have to refrigerate them, then how are they going to survive 90, 0.6, right? Like your body temperature. So what spore-based probiotics are and how they differ is each bacteria cell naturally has this sort of coating, like a shell around it. And that's where the spore, it's called a spore. And it's a protein complex that's so hardy. It will actually resist things like light and heat and pH, so like stomach acid. And therefore, you don't have to refrigerate them. Actually, we've tested them up to 500 degrees Fahrenheit. I think I was telling you this earlier, that you can actually like bake with our spores. So you can take Megaspore Biotic open and mix it in. And
I think that was such a selling point for me. I'm like, that is amazing. I can make cookies with these probiotics. Amazing.
Yes. So which is, great. They're strong, right? They're highly resistant to those kinds of things. So even antibiotics, you can take them along with antibiotics. They're really hardy. But they actually survive digestion, and that's one of the things that sets them apart. But B, when they get into the intestines, they do what we call a modulation of the gut. And this is much more intelligent than we see a lot of other species. They do this with something called quorum sensing, which is sort of a bacteria's way of like communicating to the environment. So they come in and they use quorum sensing to identify whether there are too many pathogens in the intestines for the host to be healthy. And they can actually kill those pathogens. So they can release like antimicrobial peptides and different proteins. And like, for example, how they kill C. diff. I always like this example. But C. diff is a very pathogenic in the Clostridia family, right? And the infection can be widespread and dangerous. But the spores can chelate or steal iron away from C. diff, which it's an iron-eating bacteria. So they sort of starve it indirectly, which is how they kill it. So they're very complex in their mechanism of action, but they're doing this sort of adjusting of the intestines. And at the same time, not just killing the, quote, bad bacteria or pathogenic bacteria, they actually help these good species to grow. And this is so fascinating because the spores themselves are not adding any bacteria to the intestines. They're actually coaching what's already there to grow innately, right, from the inside. And so, like I said at the beginning, we want, these lactobacillus and bifidobacterium. We want these like healthy keystone species, they call them, in our intestines. And it's really difficult to get that from the outside, the external bottle inward. And so spores are this completely different sort of perspective or like mechanism where they're coming in and coaching that bacteria that's already inside to grow. And so by doing that, they work really, really well clinically. So for things like IBS, SIBO, so small intestinal bacterial overgrowth, E. coli, like someone who's gotten food poisoning or traveler's diarrhea, they're amazing for that. Colitis and Crohn's, so helping to rebuild the mucin layer. And of course, things like eczema and psoriasis, right? So helping to heal that mucin layer in the gut, which prevents inflammation in that gut-skin axis. And actually, we can see healing in the skin. So they're extremely clinically effective and, again, very different than what you'll see on the shelf. Yeah.
Yeah. And I feel like if you clean your gut up and you are using these products, you might be doing the protocol for eczema, but you might see improvement in your skin and your, digestion or your immune system or any of those things, So it's interesting because when you treat the gut, it's like a lot of the protocols that you guys have are all the same products. You might add in this or that to kind of tweak it. But at the end of the day, a lot of them are very similar. And you're using some of those core, supplements and probiotics that you guys have. So I love your guys' like 3-prong approach. I think, it wasn't until I was talking with you that it really clicked for me, like, because we talk about this in dentistry too. Like when we're dealing with the oral microbiome, it's like, well, we need to kill off the bad stuff. And then we need to make sure the good stuff stays and repopulates, right? Yep. And then we need to make sure that all that dead stuff and all the toxins and stuff are bound up and they clear out of the body, right? So like, it's funny because the same thing that I preach about gum disease, you guys are preaching about gut health, and it makes sense, right? Like, you need to get in there and kill off the bad stuff, and you need to encourage the good stuff to stay and make that a happy space for them. And then you need to also take any toxicity that's in the gut and any stuff that you really don't want in the blood, and you need to get that out of the body, right? So you need kind of like a binder to do that, right? So I feel like that is so comprehensive. It's so much more comprehensive than just like, here, take this probiotic that's in the refrigerator section that probably won't even get into the gut to do what it's supposed to do, right?
Yeah. I know now with that 3-pronged approach, like it's kind of an easy way to explain it to patients too. Whether you're a practitioner or patient, you can benefit from it. But I like to think of it as just like a gut garden. That's what I tell my clients. It's like, you have, if you're familiar with gardening, right, and you want your veggies in your flower or your veggies in the beds, you want to weed the garden, right, so that you have space for these vegetables, right, kind of the good species. And of course, you want to make sure the soil kind of is covering all the roots and is very clean. And this idea and this image, if you can imagine that in your mind, this works this way for the gut too. So if you can imagine like probiotics or beneficial species as being your veggies, the more you plant those seeds and grow them, right, there's less space for those weeds, right, so to speak. And at the same time, when we think about, okay, if there's too many weeds in our garden, we want to pull them away carefully, right? If we were to spray like a pesticide or an herbicide all over our veggie garden, all of the veggies would die and the weeds would die, and we have nothing really left, right? And I always say, like, what's the first thing to come back? And it's usually weeds, right? Not veggies. And so using sort of that analogy is kind of like an antibiotic coming in, sort of like a gut bomb, killing everything. And there's definitely a time and a place for that. But when we're thinking about like what you're talking about with dysbiosis, meaning just too much of the bad, too many weeds, not enough veggies, we can actually carefully by hand weed out those weeds, right? That bad bacteria. And one of the spores that can do that really well is called HU58. So there's 3 products I'll talk about. There's Megaspore Biotic, HU58, and then there's a product called IgG2000, the binder. So HU58 is very, very good at sort of weeding your garden without disturbing the microbiome, without disturbing the plants, the good species. This is really important because what's out there right now is sort of these kill protocols, we call them. And this is, as you might know, like popular even in naturopathic medicine. It's like, oh, you've got bad thing, let's come in with oregano oil or olive leaf or an antibiotic. And there's like even the natural things like these oregano oil, for example, acts sort of like it's like a gut bomb going off, and it can really disturb a lot of your species. And again, when we have no species and just soil like that, we put ourselves at risk for regrowth of weeds, right? Regrowth of usually like candida or fungal species come first. So having a way to kill these pathogens very selectively is important. And spores can do that so well. And we've looked at this, we've been able to see how they address dysbiosis over just a 30-day period. They can increase the good species by 30%. They decrease lipopolysaccharide, that toxin in the blood, by actually 42% after just 1 month. And so HU58 is one of my favorites for doing that. And then on top of that, we think, okay, so HU58, maybe one of the spores is coming in and killing, but there's die-off, right? There's this, and I like to just imagine these weeds are just laying there, like you haven't cleaned them up, like you were saying. And so we need to sort of take all those weeds and put them into this bucket or wheelbarrow and haul them off so they don't rot and regrow. And that's where binders come in. So if we've thought, okay, we've killed this bacteria, just because we killed it, that's actually only the first half, We actually need to clean that up, mop it up, and get it out. And so one of our actually top selling products, it's called Mega IgG 2000, is a immunoglobulin binder. And what that means, it's an immunoglobulin, like a part of the immune system naturally, and it has binding sites for all these toxins. And so it will glob onto things like lipopolysaccharide, so bacterial toxins, actually funguses, and even parasitic toxins, H. pylori, all of these pathogens. It'll bind them up, and you excrete that in your stool. So just through a bowel movement. And so that's sort of like cleaning up those weeds and getting them out. And the result there is much faster healing of that intestinal lining, that thick gel mucosal layer that we want to see in an intestine and the oral microbiome. We want to see them both. We want to see that healing. And if we don't bind that die-off, then what that's going to do is that those bacteria are going to die and then just start eating away at that mucin layer again. And you've just got this cycle all over again. So that, again, that three-pronged approach is to seed, so to plant those vegetables, and to weed, so weed out the bad guys or the weeds, and then to bind and throw away those dead weeds. Yeah.
Well, that makes so much sense. So much sense. So, and I think, I was going to tell you, we went to Mexico recently, and every time we go to Mexico, it's like somebody in my family, at least one person gets sick. And
oh my gosh, yeah.
And I had, we had talked a little bit about the HU58 and the Megaspore and all that, and I've been using products, and I'm like, okay, I'm actually going to put my entire family on this protocol for Mexico, because it is so annoying when one person gets sick on vacation. You're like,
yeah,
well, we can't do that, and we can't do that, and this person can't come, and like all of our family photos, like one person is always missing. So anyways, we ended up, everybody took it, and like the three-prong approach protocol, including my 2-year-old, and nobody got sick. And I was like so impressed. I'm like, I don't know, I need to keep testing this, but like I feel like if you're traveling abroad, like just take those 3 products with you. I mean, those are literally the only 3 things that I brought on this trip. And I'm like, okay, I feel very good about this. And I was so pleasantly surprised. I think everybody in my family was like, wow, nobody got sick on this trip. It was amazing. It's been many trips.
Knock on wood.
Yeah, knock on wood. I still need to try it more. We need to go on more trips to Mexico, I guess. But it was just really, it was so awesome to see that. And my dad and his wife came, and they were not doing the protocol, and they started to feel a little upset in their stomach. And we were all eating the same foods, right? Same foods. And I was like, okay, you guys need to take this protocol. And they started doing it, and they felt better. Yeah. So I feel like this stuff is just so, so powerful. And I think a lot of times I feel like patients, I'm so glad we're doing this podcast, because like a lot of times people will be like, well, I just want to cherry pick. Like, I just want to take all I need to take is the HU58. Like, I just want to take that one that kills the bad stuff. Or I'm already taking a probiotic, so let me just take this one. And they kind of want to cherry pick. But I think that it's so important to understand that the approach is 3-prong, right? You really need all 3 of those products, because they work together. And they're not going to work as well unless they work together, right? And you guys have establish these protocols because the science backs them up and it works. So I would say if you're a patient listening to this, like it's so, so important that you're not cherry picking and saying, well, I just want to take this one and I don't want to do this whole thing. You're not going to see the same results. And I think in the dental world, we're looking a lot at the microbiome, and a lot of the times we see spirochetes or we see even parasites that are in the mouth. And so we know that there's an infection, right? There's an infection that's going on. And so we're going to start you on that 3-prong approach protocol because we know we have to kill things off and we have to bind everything and then we have to reseed everything and hold space to grow those vegetables, right? But then after we've done that, then there's this kind of restoration period, right? So that protocol that we typically do would be 3 months long. It would be a really intensive, let's get you kind of back on track. And then based on how you feel on that and the things that you notice, then we would probably put you on a kind of maintenance or rebuild type of protocol, right?
Yeah.
So, and that's going to have some of the similar products, but we're going to tweak it a little bit. So Ceylon, can you talk about kind of like the initial one? I feel like that 3-prong approach, we got a good idea, but then after that, what happens? Like, are people on these probiotics for life? Like, what does it look like after you've kind of reached that homeostasis?
Yeah. And one of the things to always think about is, we don't all, I wish we did live perfect lives, but we don't, right? So even if you're working really, really hard in your gut microbiome, and I can say this from my own experience and with my clients I work with, if you're trying to eat organic foods and to include more fibers and to de-stress and learn to meditate and all these things, we just don't live in a world where our microbiome is, stable and thriving, right? And so we kind of have to take this perspective that we need to, it's like a practice almost, like a weekly or daily practice to help support our microbiome. So that being said, the 3-pronged approach with mega spore-biotic helping to seed the gut and create a lot of diversity, HU58 coming in and weeding a lot of that out, and then the mega IgG 2000 binding. Usually that's about a 3-month period that someone will be on those. And what you'll notice with your testing and with stool testing is that you'll see pathogens drop significantly, like most of the time into normal levels without any antibiotic, which is just incredible. You'll see beneficial species grow. And so that could be a series of bifidobacterium in the gut or beneficial species in the oral cavity. And we'll see short-chain fatty acid production go. And that's really these byproducts of the microbes like feeding on fibers. And these byproducts are super healthy. They're good for our skin, our brain, our energy. So we see all of those things improve in that 3-month period. And then after that, those changes, and we've actually looked at this and researched, those changes are sustained. So even if you stop, let's say, the probiotic for a short period of time, your gut microbiome has this sustained change of diversity and lower toxins and all of that. But the question becomes is how long can that sustain that diversity and how long can your gut stay that healthy? And this will vary, right, depending on the person. But I'm always an encourager of supporting the gut microbiome because I think it has just changed my life and my clients' lives and makes us healthier. And so though we see lasting changes with that, what we recommend is sort of a restoration period and then a maintenance period. So after that 3-pronged approach, what we recommend is something called the Total Gut Restoration Kit. And it will be very, patient dependent, obviously, but the Total Gut Restoration Kit it's megaspore biotic. So it's that seeding of that healthy bacteria. And then there's a prebiotic. And if we're thinking about this in the frame of the gut garden, this is sort of like the fertilizer. So we're coming in and we're fertilizing and growing these vegetables, right? And we do that in this phase and not too early on sometimes, because if we're fertilizing the weeds, right, a lot of those weeds will grow. And so that's very helpful for patients to understand, like, hey, we got to weed that garden first before we come in with fibers. And so one of those products, so it's Mega Pre is our prebiotic fiber that's part of that Total Gut Restoration Kit. And that comes in the second month on that kit. And then the last one is called Mega Mucosa which is what we call like our Heal and Seal product. So that whole kit called Total Gut Restoration Kit really focuses on a complete restoration of your gut lining, of the diversity in your gut. And that's what we want. We want lots of diversity, lots of different types of beneficial bacteria, right? That's what we see in healthy guts. And so that is like, that's ideal, right? That at that point, you can have very healthy digestion. You should see things like your acid reflux go down if that's been an issue. If someone has bad breath, like that might improve. Gas, bloating, bubbles, indigestion, pain, all of those things. Even things like IBS. So if someone struggled with food sensitivities and all of that for a long time, we see that improve. And then at that point, there's this, what we recommend is just sort of this maintenance phase. This is like, hey, in a perfect world, I'm going to try to eat healthy things and reduce processed foods and not drink alcohol and coffee and all those things. And I want to still be seeding my gut, because even while doing all of those things, like there's still toxins in our environment, right, that we really can't avoid. So the maintenance dosing on that can be about twice a week, right? So Mega Spore-Biotic just by itself can do really good for maintenance dosing about 2 to 3 times a week. And for some clients, it's recommended to do that entire kit so that the Mega Spore-Biotic, the prebiotic, and the mucosa product twice a week ongoing. So it depends on the patient and what their diet and lifestyle looks like. It's, some providers will recommend to just do that total gut restoration kit once a year or once every 6 months. And, some people do like a New Year's thing. They're like, every January, I'm going to do a total gut restoration, So it's really, important to know that it's patient dependent, right? Everyone has a different gut microbiome.
Yeah.
It's like a fingerprint. So.
Yeah. And it's like, you go to Mexico, you travel, like you're going to get introduced to different microbiomes. Even like in the country, you can look at like based on the city and the area that you live in, you're going to have different types of bacteria that you're more exposed to, right? Like New York City has its very own microbiome versus Seattle.
Yep.
And I think we do our best, but even like in my experience doing all the right things, I still got exposed to mold and, you stay in hotels and there's just, you don't know what you're really you don't know really what you're coming in contact with, right? And because that gut is just so important in immune function and in all of these different things that we've been talking about, I think having that as kind of your maintenance, it's one of those supplements that you just kind of want to take, like everybody should probably be taking to just it's kind of like an insurance policy, right? But I think it's really important also, like in order to get to that fertilizer place where the vegetable garden's growing so big and tall and really amazing vegetables coming out of this, we have to pull the weeds first, right? So we've had some patients who are like, well, do I really have to do that 3-prong approach first with the HU58? Do I really have to do that? Can't I just jump to this part? And my answer is always like, well, you could, but like this is what you need, like, because you have a lot of bad bacteria, and to your point, like we're not using antibiotics. We're not using these really aggressive things. So to me, it's like when in doubt, why wouldn't you do you're not, if there's nothing bad to kill, then this isn't going to kill it, right? But we know that the microbiome is probably off. And I also think it's amazing that given your whole life and all of the things that you've come in contact with, that in just 3 months, we can kill off, and your science shows that you can kill off so many of these bad bacteria and improve leaky gut. And I mean, it's really amazing because if you ask other practitioners who do this type of work, like, well, how long does it take me to really rebuild my gut? I mean, the answers that I've gotten from other doctors are like, oh, it takes years. It's very hard. It's very hard to do this. Yep. And just in my own personal experience, my daughter, myself, it's like been amazing how quickly you see changes. And, my daughter's eczema is not completely gone. She's just 1 month into this treatment, but I mean, I'm just so impressed with what I see so far, right? And so I'm going to keep at it. But the idea that you can actually change that microbiome in a very short amount of time and it stays is just, to me, just so fascinating. So I think one of the takeaways from this is like, I want as a listener, I want you to, the 3-prong approach is so important. So if you're just taking a probiotic, you're not, there's 2 other things that you're not really addressing. And then also the quality of the probiotics and the spores are so much more effective than the other types of products that you might be getting at the grocery store, or even other products that might be promoted by even your doctor, and your doctor may not even know about spore-based products. So
yeah, it's the power of the spores for sure. And to your point, a lot of practitioners out there, whether, more Western medicine, more functional medicine, more integrated, I mean, they're not really taught about the microbiome in this way. I mean, I can say that from my personal experience, even a master's of science in nutrition, but it's very, very, very little that you learn about the microbiome. And it's just like new, exciting, emerging research. But the thing to keep in mind is you need a probiotic that actually reseeds, right, the gut and makes that sustainable change, because you can be taking a probiotic that's over the counter, let's say, from the grocery store or whatever. And while you're taking it, you might think like, oh my gosh, it's, my digestion's better or whatever. But when you stop taking that, do your symptoms come back? And that's a sign, and a lot of times they do, and that's a sign that those bacteria are not actually colonizing, meaning they're not alive and growing and staying in your gut. They're acting more like what we call postbiotics. So they're actually just kind of dead and inactive, and they're doing good things while they're in your system, but then after a couple of days, they're out of your system. And that's sort of like, now I have to be on this probiotic for life, right? You're not really like reseeding. So yeah, the power of spores can go, just like I said, so much further than we think, and clinically, and seeing improvement like in your daughter, and yourself with the mold exposure. So it's story after story, and just like so cool to be a part of. Yeah.
Yeah, it's awesome. And you guys also have sometimes we do need to use antibiotics, right? Sometimes, like if we're doing an implant surgery or we're doing any kind of big surgery, like we may actually feel like we need antibiotics.
Yeah.
My stepdaughter recently had like a tooth, like an oral surgery type of procedure, and they wanted her on an antibiotic, and the doctor that she's working with just is like, take the antibiotics, right? And in my head, I'm
Sure.
like, oh gosh, okay, we have to, that's okay. Like I'm not anti-antibiotic, but we have to put you on a protocol then to rebuild this gut, right? Because that antibiotic, like you said, with the oregano oil is going to come in and just wipe everything out. And we see a lot of dysbiosis after we have antibiotics, and we want to make sure that we are being proactive and making sure that we support that gut during that process of having the antibiotics, right? So I also love that you guys have a antibiotic, go along with your antibiotic type of protocol. And we have started to recommend that to patients as well. And I've always promoted like fermented foods and probiotics with antibiotics, but it's so awesome that you guys have the science to back up your protocol. And that's one thing I do love about Microbiome Labs, is that you guys are looking at the research and you're studying your products, and you have like so many different practitioners coming back like me saying, wow, this is really, really amazing results that we're seeing.
Yeah. One of the things we're most proud of, I would say, is the finished product clinical trial research we do. And the key word being finished product. You can see a lot of companies out there who are, producing probiotics, and they say, well, this strain, does great things for metabolism. This strain does great things for skin, and this one for digestion. So let's put them all in a bottle together, and, it'll do all those things. And that's actually not true. We're founded by a microbiologist. His name is Krishnan. And in microbiology, he's like, this is the thing that you need to know, is microbes on their own can do great things. But sometimes if you put them together and you don't study how they are together, they're like two lions in a cage. They may get along. They may just be totally kind of neutral to each other, or they could fight. And when they fight, that could create this sort of inflammatory response and actually create like the opposite of what you want. So one thing he was so set on is study the finished product and how that affects your body, and your gut. So that is just kind of a foundation. And we're continuing to do that research. So now we're getting into women's health, which I don't have to go into if you don't want to go into it right now, but I'm just so excited about it. It's the women's health part, like we talked about a little bit at the beginning, is having to do with the vaginal microbiome. And there's incredible research showing that if there's not enough beneficial species, it's called lactobacillus, specifically Lactobacillus crispatus in the vaginal canal, it can affect things like, yes, infections, putting at risk for infections, yeast infections, but also infertility rates go up, recurrent pregnancy loss, PCOS, endometriosis, pelvic inflammatory disease, all back to this vaginal microbiome, right? The actual microbes themselves, which are like these invisible things on us, right? Mm-hmm. That we don't, previously we didn't really think about and study as much. So that area of research is fascinating to me. I think women's health is kind of, up and coming, but yeah, definitely something that we are constantly involving ourselves in. Like right now, we are looking at the oral microbiome and how our spores will improve pathogens. We're in a clinical trial for that now. And also, we're doing a study on a BV, so bacterial vaginosis, and looking at the vaginal microbiome over a 3-month period on one of our products. So it's just fascinating, to be a part of it all.
That's awesome. Yeah. When you just talk about gut health, it's just like, all of the microbiomes are it's just such an interesting topic. And I feel like there's so much talk about it. But yeah, like to your point, like you'll see like, oh, well, this, like you see this a lot with oral probiotics. Will say like, oh, well, this strain, it has been shown to reduce, decay. And then you're like, oh, okay, but did you actually test your probiotic? Like, was that study done with your actual probiotic? Like, we know that this study showed that type of bacteria does this, but like, does your product actually do that, right? And I think a lot of people put these stamps on products based on other research that's been done without actually testing their own product. So I do appreciate that. And the finished product, right? So I think that is so awesome that you guys are actually testing that, because that's really what matters, right? Who cares if like, taking vitamin D levels create, better immune function. Okay, great. Well, what about your product? Does your product actually do what you say it's doing, right? Yeah. And you just don't know unless you test. And I come across that a lot with probiotics, that they kind of like to tag on to the other research, or they like to tag on to like the other gut research without actually testing their product. So
yeah, actually, there's a lot of companies that will, and this will be important for listeners too, they'll produce spores and sell spore-based probiotics. And you have to be really aware of that, because a lot of times what they're doing is they're actually using our research. So we were one of the first companies to do clinical spore-based probiotic research back in between 2005 and 2013, really when Quran was first developing, microbiome labs. So a lot of times it's they're using our research, yes, but also you want to make sure, like we were talking about, those strains are the ones like being used in that research. And I'll add to that and say with spores, you would want to make sure they're human sourced. So you want that spore to be originally from a human and therefore knows what a human intestine is supposed to look like. Because remember, they're coming in and modulating that based upon what's healthy for the host, for the human. And that's their intelligence. They work in what we call like symbiosis with us, or I think symbiogenesis is like the technical term. And they're like moss on a tree, right? That's us. It's the microbes on us, like moss on a tree. They want to be healthy with us, right? And so I always say, like, feed your babies, right? Feed your bacteria, treat them well, and they'll treat you well. So yes, you want to find ones that are derived from a human, which are the ones that we use, and of course that are used in that research. So
it's so awesome. I feel like there's just like so many. I mean, if you're listening to this and you have like basically any health issue, it's like, oh, that could apply to me. So yeah, Ceylon, if people are listening, and like, where can they go to learn more about the products that you guys have and more about the different protocols that maybe they should be on?
Yeah. So we are a practitioner-only brand, which means we sell to clinics only. And that's really important to us because we want our patients to know how to take them, right? So we put a lot of that on the clinicians to be able to educate the patients. So that being said, you can go to microbiomelabs.com and you can find a lot of our research and a lot of info on our products, or you can go to your local practitioner, right? So a lot of practitioners are selling this now. Obviously, your clinic as well at Green City is selling them. And that's where you'll find a lot of those protocols and that education. I also recommend following us on Instagram at Microbiome Labs. So you'll see a lot of good videos on there. Yeah.
Okay, awesome. And then you're doing some stuff in private practice as well too, right?
Yeah.
With your own clinic.
Yes. Yeah. So you can find me at Embody by Ceylon on Instagram or www.embodybyceylon.com. And that's INBODY, Embody. And yeah, I am a gut-focused nutritionist. I run a 3-month program to help you beat the bloat. So identify food sensitivities, improve metabolism, so lose weight, and learn about how foods affect your body and your gut microbiome. So I call it like gut-led weight loss. Awesome. And again, that's Embodied by Ceylon. Yeah.
And do you see kids at all, or is this an adult-only practice?
Yeah, I mostly focus on adults and not pediatrics. So I do have some good referrals for pediatrics. So if that's something that, someone's interested in, you can reach out to me.
Okay, yeah. Awesome. Well, this has been so amazing. Thank you so much for being on the podcast. And thanks
for having me.
Yeah,
so
I just think this is just it's such great information. And I'm always just like so passionate about people being their own advocates. And like, if your doctor's like putting you on a probiotic, you need to be asking about, well, okay, like what kind is it? Do they have studies? Like, you've got to be your own advocate. So I just love getting this information out because there's just so much out there and it's so confusing. And, you see social media ads and all this stuff. And it's like, I don't even know what to take, right? So, and I feel very confident recommending this product because I've seen it work clinically. I've seen it work on my daughter. I've seen it work on myself. And I just, I want to support products that I have seen work, right? So I feel really great about giving them to patients, and I want to talk the talk and walk the walk. So thank you everybody so much for tuning in today. If you enjoyed this conversation, be sure to follow and like the podcast so you never miss an episode. And don't forget to follow us on social media for more health tips, updates, and behind-the-scenes conversations. So we'll see you next time. And remember, your mouth and your gut matter.